So let us begin with the part 4 of the CPT medicine, where we are going to cover the allergen immunotherapy and the catheterization. So first understand what is allergy. Allergy is nothing but a foreign substance which causes the disturbance to human body. And there are multiple kinds of allergies which people are undergoing in present times. It could be the skin allergy, the dust allergy, the mold allergy, and each necessitate an entirely different treatment and the coding, and that's why one must understand this particular topic very carefully. Now let us look at what do we mean by allergen immunotherapy. It is also called as allergy shot or desensitizing therapy. It is a long-term treatment that helps reduce the allergic symptom by gradually training the immune system to tolerate the specific allergen. It is the only treatment that can modify the natural course of allergic disease such as allergic rhinitis, asthma, and insect venom, where with the help of various allergens, the doctor will prepare a particular dose and he will inject that dose repeatedly to the patient, and because of that the patient get desensitized. So this is the basic the theory behind the allergen immunotherapy. Now if you look at the code is 95115. This code is used for the allergy cases treated with a single injection without the provision of the antigen. So remember, many a time the code differs depending upon what has been done, whether the doctor has only given the injection or whether the doctor has prepared the particular dose by adding all the different antigens. That will decide the code. So let us look at the code further in detail. So the doctor will always do the allergy testing, and then he will create a allergic immunotherapy shot. So what are the different types of allergy testing? So one is a patch test, second is a scratch test, and the third is intradermal test, where the small volume of allergen is injected into the dermis using fine needle. Now, why I have covered this? Because this is a very common type of question they ask during the company interview, that what are the different allergy testing has been done. And so this is the answer. Now let us look at the code for the allergen immunotherapy. The code range is this, and for the better understanding, I have created the group into 4 categories. Now, if you look at the code language very carefully, you will see that this particular two codes, they just talk about the injection and they do not create the extract, okay? Because you will have to create that particular dosage. So they do not create that. This two code just talks about the injection, single injection and 2 or more injection. Now let us look at this bubble. If you look at this bubble, it talks about both, means it talks about including the provision of the allergenic extract single injection. So they provide, so the doctor supplies the medicine and inject also. So that is both supply and the inject. Now let us come to the third bubble. In this third bubble, doctor prepares the supplies. That's it. But they do not inject. So here I have created the bottle so that you can understand that it is only preparing the particular dose. Antigen for allergenic, provision of the antigen for the allergen immunotherapy. And this is also one particular group where again the doctor prepares the supplies. So this and this group are only for the preparation of the supply, while this is preparation as well as injection. A small hint I can give, that this group and this can't go together, because here also they are preparing and here also they are preparing. So the two preparation can't go. But this and this can go, because here they are preparing and they are injecting. Same applies for this group also. So the only way to strengthen your guideline is to do the question. A 25-year-old male patient arrives to the ENT department to see the specialist for the first time. He complains of severe rhinorrhea, coughing, and wheezing. Allergy test administered by the PCP indicate severe allergies to cat dander, mold, and dust mites. The patient arrives today to start the allergen immunotherapy. The physician prepared two multi-dose vials, each contain different antigens and each vial contain 10 dosage. At the same encounter, the patient receives two separate injections of both the vials prepared by the doctor. The patient is seen also for the detailed history examination to assess the clinical status and adjust the prescription drug treatment. How is this encounter reported? Now, in this case, when you have the multiple code, you remember if one code is wrong, the whole answer is wrong. Now we have all these codes. Now, if you see the first two codes are for the allergy, the third code is the ENM code, which is the new patient, and then these are the ICD code. So, take a time and tell me the answer. So remember, in the multiple coding option, if one code is wrong, the whole answer is wrong. Now in this case 95144, it talks about the insect venom. In our case, there are the multiple antigens. So 95165, it talks about the multiple antigen. But in the bracket they have written specify the number of the dosage. How many doses? 10 doses each. But how many two vials are given? That means 20 dosage. So we will have to go with the option C because 10 doses in one vial and they have given two vials. So 10 multiplied by 2 is 20. 95117, it talks about the multiple injection because 115 talks about only the single injection. So that also eliminate option B, and option D is also wrong because they are counting only 10 dosage. So and 99200325 is an additional service because this is the injection is given. The patient came for the all the rhinorrhea problem and the doctor gave this injection, so that's an additional service. So 99203, we put a modifier 25, and these are the code for the coughing and wheezing. So this is the answer. So the physician performs the 16 cutaneous test, scratch, puncture or prick with allergenic extract, code the procedure. And here there are, the options given. Kindly go through the options and tell me the answer. So yes, 95004 is the answer because we are looking only for the percutaneous. 95017 also include the intracutaneous and intradermal. And in our case, it is only the percutaneous. So we will go with the answer 95004 and specify the number of the test 16 unit block. Now the next important topic is cardiac catheterization, which is all known as a heart cath or coronary angiogram. The procedure provides the doctor with a roadmap of the arteries in the heart. To find any areas of the blockage in the arteries that supply the heart with the blood, it may also look at the wall chambers and heart muscle. It can help in making the decision about the treatment of the heart disease. And it is usually performed by the cardiologist with the assistance of the RT nursing and support staff. So this is the information of the cardiac catheterization. So what is the cardiac catheterization? It is nothing but a procedure where a thin tube is inserted into the blood vessel to diagnose and treat the heart condition. Now let us look at the two types of the heart cardiac catheterization. One is diagnostic, where we are trying to diagnose the problem related to the heart. It could be measuring the blood pressure or the oxygen level or the problem with the heart chambers. And the wall problem or the blockage. And when we talk about the therapeutic cardiac catheterization, it is basically the treatment of the heart diseases. Like if there is a blockage, then we will do the balloon angioplasty and the stent placement. So the previous code that you have seen, those were the therapeutic cardiac catheterization, and now what we are going to see is the diagnostic cardiac catheterization. So the diagnostic cardiac catheterization range is 93451 to 93598. Now in the diagnostic cardiac catheterization, there are two main coding family exist. One is when we do the cardiac catheterization for the congenital heart disease, and this is the code range. And the other is non-congenital, and for which we have this code range. So pay attention to that. So these are the code for the diagnostic catheterization. And if you see, you have the code for the right, you have the code for the left, and then there is a combo code which includes the right and the left catheterization. Then we have the code for the coronary angiograph and then the coronary and bypass angiograph. So the codes are very specific, so pay attention that what has been done. Some of the codes are coronary as well as the right heart catheterization. So you will understand what has been done in the patient and then accordingly you will pick up the code. And remember that whenever there is a combo code, we will choose over the single code. So the parenthetical note below every code is very important. Pay attention to that, and that will help you to zero down a lot of answers. So this is just a flow chart which I have given that will help you to understand that what has been done for that code. So right heart catheterization is with the blue, left is green, and when this is the combo code, so which is blue plus green, this is coronary only where they don't enter the chamber, and while this is the code where they enter the chamber but they enter the coronaries also, and then they in that also there is a bypass graft, so that is also another important consideration. So pay attention what has been done in the patient and choose the. Now, when the diagnostic cardiac catheterization is done in the patient, there are certain services which are included, and one is local anesthesia, then the introduction and positioning and repositioning of the catheter, recording of the intracardiac intravascular pressure, obtaining blood samples for blood gases, cardiac output measurement, monitoring services which include oxygen saturation, ECCS, arterial pressure, vascular catheter, and line removal, final evaluation, and written report. All these are the included or the bundled services. Now let us turn our attention to the cardiac catheterization which is done for the congenital heart disease. And if you see, these are the codes that we use it for the congenital heart disease cardiac catheterization. Here the catheter placement work for the CHT is included in the main procedure, and use the most specific code for the vessels or the cardiac structure. Now, a very important note, one must or the point is the injection procedure. Due to the variability in the cardiovascular anatomy in the congenital heart defect, injection procedure are separately reportable. This include the contrast injection. This include the contrast injection performed by angiography of a specific vessel or cardiac structure. Remember that when we do it for the non-congenital heart, the injection procedure are included in the code. But here, because the anatomy is very varied, we exclude, we code the injection procedure separately. So let us take some question to understand the guideline better. Left heart catheterization retrograde from the femoral artery with the injection procedure for selective coronary angiography and selective left ventriculography, including imaging supervision and interpretation with report are performed. The cardiologists perform all the services at the hospital. What are the CPT code? Now, when you look at the question, let us find out that they have done the left heart catheterization, coronary angiography, and selective left ventriculography. So these are the data point that we have. Now go through all the options and tell me the answer. So if you go through the option 93 460, it is the right and the left heart catheterization. In our patient, it is only the left heart catheterization that has happened. 93452 is left heart catheterization. It includes the left ventriculography, but it does not include the angiography. So kindly read all the codes and then tell me the answer. So yes, 93458 is the correct code because this code include everything: left heart catheterization, coronary angiography, and left ventriculography. So we will go with that code. So let us take one more question. The question is more or less same except the options are different. A patient undergoes the left heart catheterization retrograde from the femoral artery with an injection procedure for the selective coronary angiography and selective left ventriculography, including imaging, supervision, and interpretation with report. All the services are performed by the cardiologist at the hospital. Which CPT code are reported, and we have the option. Now study the options very carefully and answer the question. Now if you see here, there are certain options which are indented, like this particular is not a standalone code but it is an indented code. So you will read the language carefully and answer the question. And if you look at the code 563, it is the code for the selective coronary angiography but congenital heart catheterization. So we cannot even think about the congenital heart catheterization because that is not the language of the, or that is not the understanding we get from the question. And even this is the code for the congenital heart disease. So we can eliminate option C and D, and in between A and B, tell me the answer. So yes, A is the correct option because 93458 is an indented code. And while reading the code, I'm going to read the code catheter placement in coronary artery for the coronary angiography, including intraprocedural injection for coronary angiography, imaging, supervision, and interpretation with the left heart catheterization, including intraprocedural injection for left ventriculography when performed. And that's why this is the correct answer. Let us take the next question. A 58-year-old male patient undergoes a right and a left heart catheterization with left ventriculography. During the catheterization, the patient participates in the physiological exercise study using a bicycle ergometer. How should you code for this services? Now, let us look at the code option. So 93531, 93464, 93451, 452, and 453. So let us look at the code. What is the code for the 451? The code is for the right heart catheterization. 452 is for the left heart catheterization. 453 is the combined right and left. Now, in our patient, when right and the left heart catheterization is done, and when we have a combo code, we will select that code over the individual code. So that's a big hint for you. So go through all the options and tell me the answer. So yes, B is not the correct answer because it is talking about right and the left catheterization code separately. We will choose always the combo code, which is 93453. And remember that there is a physiologic exercise study that has been carried out, and that is not covered in this code. So in order to cover that, we will have to write an additional code, that is 93464. Kindly check that we can use this code in conjunction with all this code, and that's why C is the correct answer. Now let us look at the operative report. Indication is hypertension with acute myocardial infarction. Procedure is insertion of Swan-Ganz catheter. Description is the right internal jugular and subclavian area was prepped with antiseptic solution. Sterile drops were applied. Under usual sterile precaution, the right internal jugular vein was cannulated. A 9 French introducer was inserted and 7 French Swan-Ganz catheter was inserted without difficulty. Right atrial pressure were 2 to 3, right ventricular pressure 24/0, pulmonary artery 26/9 with a base pressure of 5. This is a Trendel Lenberg position. The patient tolerated the procedure well. So now they have given the code. What they have basically done in the procedure is they have inserted the Swan-Ganz catheter. And remember that we have a separate code for that, that is a 93503. 93505 is a endomyocardial biopsy. So we can't take that code. And 9350531 is also not the correct code, and so we will zero down our. So yes, 93503 is the correct code because it is the code for the Swan-Ganz catheter, and these two are the code for the ICD code. One is for the hypertension and second is for the acute myocardial infarction. Let us look at the next question. Mrs. Emma has a severe atrial fibrillation. She presents today for an EPS study. Dr. H. Prince performed the professional component of a comprehensive EPS study, which includes right atrial and ventricular pacing, recording, bundle of his, recording and induction of the atrial fibrillation. How should this service be coded? And you have this mini code. So remember, the code language is very important. Now, why I'm saying that, if you look at the code 620 and 619, the codes are pretty much same. There is only one word which is different. That if you look at the code 93620, it includes the arrhythmia induction, attempted induction of the arrhythmias, while 93619 it does not, without induction or attempted induction of the arrhythmia. So that's the only difference. So in our patient, there was an attempted induction of the atrial fibrillation that has happened. So in between 619 and 620, we will go for the code 620. Okay, so we will definitely require a code 620, and now you tell me the answer. So yes, the correct answer is 93620, because that's the answer which covers even the arrhythmia studies also, and that's what happened in our patient case. And below 93620, you will see the parenthetical note which says that do not report 93620 along with all this code, and that helps us to eliminate the option D as well. And we know that we cannot write 619 and 620 together, because one covers the arrhythmia, the other does not cover the arrhythmias. So is the right answer. Now the next question is, a patient with atrial fibrillation had a dual lead pacemaker implanted 1 year ago. Today she returns to the physician office for evaluation of the function of the device and reprogramming if needed. What is the appropriate CPT code? So it is, what is the machine? It is a pacemaker. And how many chambers? It's a dual lead. So that is the important thing, and she has come for the reprogramming. Go through all this code and tell me your correct answer. There are some code for the defibrillator, there are some code for the pacemaker. So like 289 and 283, they use the language of the defibrillator. So that also gives you a clue of eliminating option D, C and D, and we have left with A and B. Now tell me the correct answer. So yes, option B is the correct answer, because it covers the dual lead pacemaker system. So this is my last slide, and then I'll see you in the part 5, where we are going to cover the hydration and some of the topics which are left, like the orthopedic topics, which we will cover in the last.